Hello, Dr. Andrew Lim from the Dental Implant Center here with you today. Today, I want to share with you a case that we did in the Dental Implant Center. It's a full arch of implant bridges with no pink, as you can see, from start to finish. So our patient today presented with multiple missing teeth and teeth that were not in great condition, and so we wanted to help the patient along, and I think the patient also, she felt like she wanted something fixed and she felt that implant treatment would be good for her. So when we first see the patient, we do diagnostics, and part of that involves a panoramic radiograph. So you can see on the image here that the panoramic radiograph shows some root stumps, heavily restored teeth, missing teeth, but in general good bone. And so these are things that we take into consideration when we treatment plan for a patient and to give the patient all her options. This little video shows you part of the diagnostic procedure that we do. We take impressions for the patient to fabricate a mold of her upper and lower teeth, and then we can digitize this and we can plan where her new teeth should be. We can plan the teeth positions, the shape of the teeth, and so that we know down the line where to place the implants in reference to those teeth. So over here on this image, you will see the implant planning software that we use. So with the teeth positions that we design for the patient, putting the teeth in the right position, we can then decide where the implants go in relation to those teeth. And we want the implants to come out on the inside of the teeth so that we don't see the holes on the outside of the teeth when the patient smiles. And so this image shows you the green and the red dots are where we propose the implant positions to be based on where she has good bone, and also so that they emerge coming out from the inside of the teeth. So this is the view without the the red and the green holes, showing you where we need to place the implants using this guide. So this guide will be then printed or mailed by the lab, and we will use it during the surgery to guide us on placing the implants in the proper position. So now comes the day of surgery, and you will see here that there are many tools that we use, many drills that we use in order to get the implants in the right position as precisely and accurately as possible. So apologies for the bloody slide, but this image shows you our strategic extraction protocol, where we place the implants in the positions as seen in the previous slides. We make sure that the teeth that are to be extracted are extracted later on. And the reason for that is that we want to make sure the implants go in at sufficient insertion torque. They have to be stable enough, because our plan is to give the patient a fixed provisional on the day of surgery. We like to do this because we want to keep the patient as comfortable as possible after the surgery, and we like to provide something that is fixed so that it doesn't move around when the patient is functioning. And we keep the teeth there until the implants are placed, so that when the implants are placed in, we can measure the insertion torque. And if the insertion torque is high enough and the implants are stable enough, we can then go ahead with the removal of the teeth and then provide the patient with a provisional on the day of surgery that are fixed to the implants. So this image shows you that yes, the implants were placed at a sufficient insertion torque, and so we proceeded then to remove the teeth, and you will see a little bit of graft material placed into the sockets. This is just to hold the bone volume for the long period of time, and they do not affect the healing of the implants in any way because they are at a different site. So like I mentioned, we like to provide our patients with fixed provisionals if at all possible. And in this case, you can see the provisional that we made connected to the implants. And I want you to pay special attention to the tissue side of the provisional. So this area has to be hand sculpted very meticulously to be convex, smooth, and rounded. And the reason why is because at this stage is the perfect time when we insert this to provide a scaffold or something for the tissues to heal nicely around. And this is really important for affecting the later stages, which you will see. So this is the end of the surgery. The patient leaves with a fixed provisional with beautiful teeth. And right now we are just waiting for healing. We obviously make radiographs again, just to make sure that everything is seating properly. So if you can see there are 7 implants placed in her upper jaw. If you look really closely, the last one on the left of the screen here, which is the patient's right, you don't see a post on it. And the reason why that is so is because the insertion torque on this implant was not sufficient. However, we were still able to provide the patient with fixed teeth using the 6 implants that you see. This is after some healing of the tissue, so you can see that immediately the tissues start to form around the contours of the provisional, which is really critical in getting the aesthetic result that we want. After more healing, at this stage, we are ready for the impressions of the implants and moving on to the definitive restorations. So over here, you can see the definitive restoration, which is high-strength ceramic zirconia, and these are all cemented onto titanium cylinders that are going to be placed on the implant. So I put these 2 images side by side. On the right, you can see what the patient came with, and you can see in the front that the tissues are really flat. And this is typical of what happens to your tissues after you've lost teeth for a really long time. And because of the extra care that we took to make sure that the tissues are sculpted properly, you can see the final result where the tissues are formed against the provisional that we provided, which is really what makes the difference between a really nice result and an average result. Again, this is another view of the top teeth, and even without the teeth in this image, you can tell where each tooth is supposed to be in the arch. And this is the final result of the zirconia restorations that are delivered on the upper arch, and the patient is really happy. The tissues look really healthy, and this overall, you can see the emergence of the teeth from the tissues look as if they were natural teeth coming out from her own gum tissue. And the final panoramic radiograph, we want to make sure that everything is seating properly, everything is passive, there are no gaps between the prosthesis and the implant, so that the patient has the best chance of keeping these for a really, really long time. So that was the upper arch, and after the upper arch, the patient is now back for doing the same thing on the lower. And so the same thing, we have diagnostics done, we make an impression, we can digitize it, and so we can plan the new positions of the teeth, because you can see here that the teeth are crooked and crowded, and so we're unable to use her existing teeth as a guide for where the implants are supposed to be. We need to make a new set of teeth in new positions and then plan the implants in those positions. So on day of surgery, the same thing. Now you will see that there are 2 teeth here after the implants are placed. And you've guessed correctly, that's because these implants, when they were placed, they were not at a high enough insertion torque. And so remember, in the upper arch, we were able to remove all the teeth because the implants were placed at a sufficient insertion torque. In the lower, because we kept the teeth and the implants were not placed with sufficient insertion torque, we can then use the teeth as a support for the fixed provisional, so the patient doesn't have to go back with something removable. And so we see here the provisional that was made that's supported by the 2 canines on the bottom, and the patient can go back, function comfortably as the implants osseointegrate and heal. So you see here that the implants are placed, 6 of them, with cover screws being placed on each of them and no posts sticking out because they were not stable enough to be loaded on the day of surgery. You can see the 2 teeth that were left to support the provisional, which will be removed when the implants have osseointegrated. And so when the time comes for us to load on the implants, another provisional was made that is supported by the implants in preparation for the day of the second surgery, where the teeth are removed, the implants are exposed, and the provisional is given to the patient. So this is after the teeth have been removed, the bottom 2 canines have been removed, and the provisional is delivered on the implants. And now we are waiting for the tissues to adapt to the provisional in the same way as you saw in the top. So over here, you can start to see the posts on the implants have already been placed, and this is the panoramic made so that we are certain that the provisional fits perfectly on the implants. This is a view of the zirconia definitive restoration on the bottom, on the lower teeth. Again, you can see this view shows the fitting surface of the zirconia to the gum tissue, and we take special pains to make sure that everything is nice and smooth, and so that plaque, food, debris doesn't get trapped underneath, so the patient gets a chance at keeping these for a really long time. These are the images of the tissue that was sculpted after the provisional was made in preparation for delivery of the definitive zirconia restoration. And you can see that the tissues have adapted really well to the provisional here as well. And this is the last image. It shows you the final result of 2 full arch implant bridges on the top and the bottom, and a really nice, beautiful smile with teeth emerging from the gum tissue as if they were her natural teeth. And the patient was really happy about this. Again, final panoramic radiograph to make sure everything fits perfectly, and patient is really happy with the result, and so are we. And this is a final smile. Really natural looking. You can also appreciate that the teeth have a bit of translucency at the bottom edges of the teeth, and I think the patient was delighted at this outcome, and so are we.